Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about metabolic alkalosis. Metabolic alkalosis is a condition in which blood pH increases greater than 7.45. The normal blood pH is 7.35 to 7.45. If blood pH is less than 7.35, it is acidotic, that means more hydrogen ions. And if the blood pH is greater than 7.45, it means it's more alkalotic. And you call it as a metabolic when the bicarb level is greater than 26. The normal bicarb level is 22 to 26. Bicarb is basic in nature, and if the bicarb level goes beyond 26, it can lead to metabolic alkalosis. Now let's see what are the causes of metabolic alkalosis. Remember the word alkali. A stands for acid loss through stomach. Stomach has gastric acid. It is acidic in nature, and this loss of acid through stomach due to prolonged suction or vomiting, remember you are losing acid, that can lead to metabolic alkalosis. Now L stands for low chloride level. So when you have a low chloride level, the body compensates by decreasing the excretion of bicarb by the kidneys. So the bicarb level goes up, that can lead to metabolic alkalosis. Low potassium or hypokalemia. In hypokalemia, there is low potassium in the blood. As a result, potassium move out of the cell in exchange of hydrogen ions. So hydrogen ion move into the cell. So hydrogen ion in the blood drops. When hydrogen ion in the blood drops, blood pH increases, that can lead to metabolic alkalosis. A stands for aldosterone elevated. Aldosterone is a hormone. It is secreted by the adrenal cortex. It increases the retention of sodium and water and increases the excretion of potassium. Along with that, it also increases the excretion of hydrogen ions while retaining bicarb. So when hydrogen ion is excreted, again the blood pH increases, that leads to metabolic alkalosis. L stands for loop and thiazide diuretics. When you administer loop and thiazide diuretics, it increases the urine output. It also increases potassium excretion, can lead to hypokalemia and can lead to metabolic alkalosis. Last, I stands for infusing too much of sodium bicarb. Sodium bicarb is basic in nature, and infusing too much bicarb can lead to metabolic alkalosis. Now let's see the compensatory mechanism with metabolic alkalosis. So there are two organs in our body that helps to maintain the blood pH. It is lungs, respiratory, and kidneys, which is metabolic. How does lungs helps to maintain the blood pH? When carbon dioxide is inhaled or carbon dioxide produced as a byproduct of metabolism, it combines with water to form carbonic acid. This carbonic acid is a weak acid, and it splits into bicarbonate and hydrogen ion. So the more the carbon dioxide, the more hydrogen ion is produced. So when there is hyperventilation or when the rate increases, carbon dioxide is removed from our body. As a result, low hydrogen ion is produced. So low hydrogen ion, it increases the blood pH. In hypoventilation, when the rate decreases, carbon dioxide is retained in the body. The more carbon dioxide, it increases the hydrogen ions. When hydrogen ion is increased, it decreases the blood pH. Now coming to kidneys, kidneys can excrete or retain both bicarb and hydrogen ion and help to maintain the blood pH. So what is the compensatory mechanism in metabolic alkalosis? In metabolic alkalosis, pH increases, bicarb increases. So your body tries to compensate by bringing down the pH. To bring down the pH, hypoventilation happens. The rate decreases so that the more carbon dioxide is retained in the body, more carbon dioxide is formed, more hydrogen ions. As a result, it can decrease the blood pH. Signs and symptoms include bradypnea, that is low respiratory rate, hypoventilation. It can be even dangerous, can lead to respiratory failure. Other signs and symptoms is mainly due to the electrolyte imbalance. Example, low potassium can lead to dysarrhythmias, prominent U wave, tetany, tremors, muscle weakness, and cramping. Now the treatment. Treatment depends on the cause. You have to monitor the EKG changes, respiratory rate status. Antiemetics if there is nausea, vomiting. You have to hold the diuretics, especially loop and thiazide diuretic. Replace potassium and chloride, and at times Diamox is administered. Diamox or acetazolamide, it's a carbonic anhydrase inhibitor. It is a diuretic. It also decreases the reabsorption of bicarb and promote the excretion through urine to treat the metabolic alkalosis. So today we learned about metabolic alkalosis, and thanks for watching my video.